Patients understand that their dental screenings and their dental checkups are real, make any recommendations. They don't make any change in the treatment protocol, and they just hope it'll go away.
This is such great information. And again, for people listening with kidney disease. Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of a Kidney Coach, Kidney Disease Solution, and our formulas, Hygenesis. And I'm joined again today by the beautiful, amazing Dr. Ellie Campbell and her dog there in the background.
Yeah.
Ellie is a family physician, a functional medicine doctor, and what I love about Ellie is, and if you go back and watch some of our other podcasts, you'll see her story about how she really got into functional medicine through treating one of her favourite patients, and her story of what happened with her journey, which is really amazing. But the other thing I want to say about the amazing Ellie Campbell is that she has just written a book called The Blood Pressure Blueprint, and it is all things blood pressure and how to treat it. But what is really amazing about this book, there it is, thank you, hold it up, be proud woman. It's an amazing book because think everything you know about blood pressure and just think salt and diet, not exercising, and then think, throw it out the window, you don't know anything. Dr. Campbell knows everything about blood pressure because there are so many things that contribute to elevated blood pressure and cardiovascular disease, leading to things like chronic kidney disease and all of those sort of things that most of us aren't taught about. Know that hypertension is the second leading cause of chronic kidney disease, being end stage of that, and that heart disease and heart failure and heart attacks are, I don't know, where do they sit on the cause of death in the US?
Yeah, US #1, cardiovascular disease, the #1 killer in our country. February is American Heart Month, so we do like to focus our attention on hearts during February. It also happens to be Valentine's Day. And so I think it's important because, especially women, we tend to really worry about our breast health. And the media attention to breast health is wonderful, but only 1 in 31 women die of breast cancer, and 1 in 3 women die of cardiovascular disease.
Yikes.
So it's a 10 times bigger problem, and people don't pay attention to it. Partly, I think, because breasts, we can identify a problem, whether that's by mammogram or physical exam, or our partner finds something, but hypertension is usually silent. Some lucky people can tell when their blood pressure is elevated. They get a headache, or their ankles swell, or they feel a rush in their, or a thumping in their ears. Those are the lucky people, because if they can identify that their blood pressure is elevated, they'll be motivated to make a change. But that's not most people. Most people, it's a silent stealer of vitality and organ function. And if we identify it by properly checking our blood pressure at home and at the doctor's office and getting trends over time, then we can start to identify who really has blood pressure problems and who doesn't. Because there's some sneaky things, and many people, I think, are afraid of the dentist. They hold off going to the dentist. And we say to the dentist, on a good day, you save a tooth, but on a great day, you save a life. And I think that if patients understand that their dental screenings and their dental checkups are really life-saving screenings and life-saving checkups, they'll be a little bit more motivated to go. We also have to make sure that the dentists have the skill set to recognize the problems when they see them, because sadly, we've sent some patients to dentists who say, oh, that's just a little bit of bleeding. It'll be fine. I'll see it in 4 months. And they don't make any recommendations. They don't make any change in the treatment protocol, and they just hope it'll go away, and it won't. Another thing that we can do is oral probiotics. We know that taking a probiotic for your gut can change your gut health. Changing the bacterial balance in your mouth can change your oral health. It can reduce the amount of plaque buildup that you make. It can reduce bad breath. It can increase nitric oxide. It can lower your blood pressure. So using a specific dedicated oral probiotic, and there's a few on the market that we're particularly fond of, really do shift the needle.
Amazing. This is such great information. And again, for people listening with kidney disease that might be driven by hypertension, it's And I don't know if you find this with kidney disease, but sometimes and I've got a big online group where people are doing our mastery course, and mum's like, I'm not sure what caused my kidney disease. We thought it was menopause, this and that. And because of you, and because we'd had a thing, I'm like, have you had any recent issues with your teeth? And she had. When we went back and had a look, we could see that she didn't have major hypertension, but we talked about some of the plaque stuff that you had spoken about in a previous podcast, and we went back and did some teeth work, and her EGFR has gone from, she's got one of the most amazing shifts in EGFR from, I think it was 37 all the way back up to 75. So it's one of the biggest shifts I've seen. And that was when we dug into, one of the things I thought was it was oral hygiene related, and she had the gene. So that the gene with the, I forget which one it is, where the red blood vessels will produce more of this certain plaque when the plaque gets inside the red blood vessel and makes it make plaque inside the walls. I highly recommend it to anyone with kidney disease, especially if hypertension is the driver, or anyone in your family has hypertension. Again, I'll put all Dr. Campbell's details below and a link to the book. If you want to know more about what we do, head to www.kidneycoach.com. We're also on Instagram and Facebook and all those good places. Remember to hit subscribe and like. That way you get notified when I get Dr. Campbell back on to talk all things micronutrients when it comes to elevated blood pressure. Dr. Campbell, thank you again for your time. I know you've been busy and just got back from the Amazon and just celebrated a birthday not long ago. Happy birthday.
Yes, I did. Thank you so much.
Pleasure. And again, thank you for being part of our community, and we look forward to seeing you all next time. Bye.
Yes, ma'am. Bye now.